All right, this next disorder, this is called idiopathic thrombocytopenic purpura, also known as ITP. Um, it's not necessarily that I want you to understand the pathophys of this. I really want to focus more on patients with platelet disorders. So more of my focus is going to be what do we do for a patient on bleeding precautions. Okay, so I'll get to the slide that I specifically want to cover in just a second. So ITP, this is where you have platelet destruction by the immune system. So anytime you have issues with your platelets, your patient's high risk for bleeding. ITP can be secondary to an acute viral illness. So this could be after your patient's had a viral infection. This could be secondary to drugs or a drug reaction. It can also be secondary to immune system dysfunction. So anything that attacks your platelets or platelet destruction, and again, I see this a lot with post-chemotherapy, for example, your patient's going to be high risk for bleeding. So what are we looking for? Any signs of bleeding. So petechia, this is a picture of petechial hemorrhaging, that pinpoint bruising. You can have ecchymosis, okay, or you can just have frank bleeding, okay? Anytime we have low platelet levels, your patient is high risk for bleeding. So for ITP diagnosis, so we're going to do a CBC so we can get our platelet count. We're going to do bleeding times, and we're going to do a bone marrow aspiration. So anytime we want to look at any type of blood cell destruction issue, so whether we're talking about red blood cell destruction, white blood cell destruction, or platelet destruction, we got to get in the bone marrow, do an aspiration, and look at the cells. And so what we're looking at here is we're going to look at those platelets here. So therapeutic interventions, we're going to do a lot of the same interventions we do for chemotherapy or any type of bone marrow issue. Okay, so steroids will help with that inflammatory response. Chemotherapy, if they're not already on it, if it's caused by like a viral illness, for example, they could initiate chemotherapy to work on the red bone marrow itself. We will have to do transfusions. So again, here, this patient would require platelets. Okay, so we can actually give this patient platelets here because that's what they're deficient in. We may have to give vitamin K anytime you have patients that have clotting issues or bleeding issues. You know, vitamin K is what we're going to actually administer here. We could probably do, I don't know why chemotherapy's on there twice, sorry about that. Sometimes you will see patients that will require a splenectomy here, okay? And I'll talk about splenectomy at the end of this chapter. Nursing care is we're going to implement bleeding precautions, okay? We're going to recognize and report signs and symptoms of bleeding, and we have specific teaching that we do for the patient and the family. So here is the slide that I really wanted you to know, okay? This is going to be the focus of what I'm going to talk about. So anytime you see me use the word thrombocytopenia, okay, that means that we have a low platelet level, okay? And that means that we implement bleeding precautions. So some of our things that we do for bleeding precautions is we're going to encourage the patient to use an electric razor, okay? We don't want to use a straight edge blade here. We will have them use a soft bristle toothbrush, okay? We don't want to irritate those mucous membranes. We avoid any invasive procedures and injections. This is not a patient that you want to give to a brand new nurse to start their IV, okay? You want to minimize the amount of invasive procedures. We want to minimize our blood draws. We are not going to give this patient IM injections, okay? So we will maintain pressure if a blood draw is essential. So we will apply direct pressure on any venipuncture site. We want this patient to wear shoes or slippers. We certainly don't want them going barefoot anywhere. We want to avoid bumps and bruises. So that may mean this patient's on bed rest, okay? We want to avoid any aspirin or NSAIDs or any aspirin containing products because we don't want to encourage the bleeding. We administer a stool softener because again, we're dealing with potential for rectal bleeding. So we want to do stool softener. We handle the patient very gently. We don't just throw them up in the bed when we're scooting them up. You know, we carefully move them, okay? And we talk to the patient about gentle nose blowing because we don't want to dislodge any nasal clots either, okay? So this is the big thing that I wanted you guys to take away from this. So anytime you have low platelet levels, we're going to implement these bleeding precautions, and these are the things that we're going to teach the patient and the family about.